Hello friends, welcome to my YouTube channel. Today we will see about the basics of nursing process. The nursing process is a systematic problem-solving approach to caring for patients. It involves 5 steps. That's the assessment, diagnosis, planning, implementation and evaluation. First is the assessment. The nurses assesses the patient's physical, psychological and social needs by collecting data through observation, interview and examination. So under the assessment there is a subjective data and the objective data. Subjective data is which patient says to the nurses, and objective data is nothing but the which observed by the nurses. Second one is a diagnosis. So diagnosis based on the data collected, the nurse makes a nursing diagnosis, which is a statement that describes the patient's actual or a potential health problem. Third is the planning, or we can say the intervention. The nurses develops a plan of care that addresses the patient's identified needs and the goal. Fourth, implementation. The nurse carries out of the plan of care, providing intervention and treatment to the patient. Fifth one is evaluation. The nurses evaluates the patient's progress and makes adjustments to the plan of care as needed. So, this process is cyclical, meaning that the steps are repeated as necessary to ensure that the patient's needs are met and that the plan of care is effective. Make sure to subscribe my channel. Thank you. Have a great day.